Good morning, everyone. And again, I want to thank Dr. Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital Trinity Healthcare, and Patrick Leonardo, the Director of Operations for AMR. They've been fantastic partners, and we appreciate that. I want to thank my sign language young ladies that are here again. Thank you very, very much. It's much appreciated. And I hope each and every one of our viewing or listening or reading audience, you and your families are doing well. I want to thank the media again, from the TV to radio to print, for continuing to get out this important, pertinent information. We appreciate the partnership. And I want to thank all my cabinet heads again, down to rank and file, who have been tested and true through a number of natural and man-made disasters, and continue to provide for our residents of Springfield and business community of Springfield. And I want to thank their families too, because families have had to sacrifice. Total COVID-19 cases now tallies to 12,673. The weekly total was 1,177. Monthly has risen to, for January, 1,351, 1,351. Deaths, unfortunately, we had 10 more. Commissioner Helen Carlton Harris indicates to me that this dates back to January 3rd, 2021. So with the addition of 10, that gets us to a total of 168 Springfield residents who have had their lives taken away pertaining to COVID-19. And once again, our thoughts and prayers and sympathy and encouragement go out to the affected families. The breakdown is white is 69, which is 41%. Black is 37, which is 22%. Hispanic is 57, which is 34%. Asian is 5, which is 3%. Those 10 additional deaths all occurred in residential settings, which now moves us up to 110 who have passed away in residential settings, which is 65.4%. In turn, long-term care facilities has stayed stagnant, which that is good, 58, which is 34.5%. First responders, and I want to thank Commissioner Helen Carlton Harris and Patrick Leonardo, AMR, and crew. The first responders, the vaccines have started for the police and fire departments. We're deeply appreciative of that. I'm also appreciative of Dr. Kerouac and Dr. Roos's efforts as they get their vaccines out. We also urge you to get your flu shots. I want to thank Superintendent Warwick, Patrick Sullivan, and Commissioner Helen Carlton Harris. We have tested our high school student athletes. 208 have been tested as we move into the winter season with a couple of sports. That's very good. My understanding is those student athletes will be tested 3 times. So the first is already done. So thank you to everybody involved on that. Governor Baker stopped the spread in partnership with AMR and Patrick Leonardo. That continues. We look to expand that. The Vax Force that has been created by Commissioner Helen Carlton Harris and myself. Our first meeting is tomorrow, Tuesday. And again, this is to get information out and to educate the public, legitimize this and credibility about the importance of taking this vaccine. Commissioner Carlton Harris and Director of Facilities and Parks, Pat Sullivan, are working on logistics already, possibly up to 10 sites for public vaccination to occur at the appropriate time. So they're putting the pieces of those puzzles together as we speak for the public vaccine to come out. We want to be ready to continue to roll with that. Some updates. We will continue to adhere to Governor Baker's and Department of Public Health, State Department of Public Health's restrictions. Those continue on for 2 more weeks. We had a fantastic meeting with Chairman Neal, Congressman Neal Ritchie, Friday morning. We're very happy that he is okay on the atrocities that occurred to our Capitol. I've already spoken on that last week. The meeting pertained to the federal recovery programs and monies to come in, and it was very beneficial. He knows our needs, and he's always delivered, and it was good back and forth feedback from all my cabinet heads. So we appreciate Congressman Neal's continued efforts, especially for the city of Springfield and the whole district, the state, and the country. I had the opportunity to tour Putnam Vocational Technical Academy on the I-waves and all the filtration and ventilation retrofitting and upgrading that we have going in with Director Sullivan for clean air movement. Just absolutely wonderful. And I, with Superintendent Warwick and again to Director Sullivan, Pat Sullivan, we continue to retrofit all our schools and all our public buildings, and that's moving forward. It's millions of dollars investment. Not only helps us short term, but it's going to be very beneficial long term. Something that was near and dear to my heart, La Florentina Pastry Shop. We had 75th anniversary. We did a celebration, a little celebration last week, and they're the best bar none. Nobody makes a better rum cake or sweeto. I don't care where you're at. So to Anna and Leo Daniele and the family and the team and the staff there, thanks for your continued belief and investment in the city of Springfield. And again, that has been an Italian-American bedrock, not only for the city of Springfield, but for Western Massachusetts. So that was fantastic. Some good things do happen like that, and I had the opportunity to meet a young lady, Alice LaValle, 100 years young. And I was able, the family had asked me, and I look forward to that, was able to visit her home in a car parade and on the porch give her a proclamation. So, Miss LaValle, I know you might be watching. In Italian, we say Chindan. Now I have to say Chindadeers, 110 years. And she was looking good, and she was sharp as a tack. Happy birthday. We are still going to continue to hold traditions that are sacred. And in turn, the Martin Luther King Day flag raising will occur here in the city of Springfield. Finalize that Friday evening with my assistant, LeVar Glick, NAACP President, Bishop Talbert Swan, and we will have that flag raising. This will be toned down following COVID-19 rules and regulations. 10:30 this Friday, the 15th, at City Hall. Governor Baker and Lieutenant Governor Polito were back in Springfield. They're only a phone call away, but they like the visit. And even with the COVID going on, major announcement at our Springfield Innovation Center on Bridge Street, Mass Tech, broadband expansion, especially for gateway cities, $9.2 million. Comcast, Verizon, Charter Communication officials were there. Broadband access is extremely important, more than ever now with the COVID-19 we're going through. So we're very thankful to Governor Baker, Lieutenant Governor Polito. Martin Luther King Church There might be an announcement coming out as early as today pertaining to that arson case, but just as important, we were with Dr. Reverend Avery last week and the Council of Churches, Archbishop Timothy Paul Bayman, to support and to donate to their rebuilding and recovery of the church. I continue neighborhood meetings. I met with the New North Citizens Council on housing and eco-dev development projects with Jose Claudio Norman Roland, Director Tim Sheehan, Minnie Morero from my office, and Chief of Staff Tom Ash. In the spirit of cooperation, we'll start meetings this week with new Council President Marcus Williams as we look forward to do and work together for the overall good of the city. We continue our Department of Justice, DOJ, and Judge Ireland's collaboration with the Springfield Police Department, Commissioner Clapper and Solicitor Pakula. I know we have another update call, conference call coming up this week, so we can move to continue initiatives and resolve on police reform aspects. We continue the Oasis Food Bank at Central High School. I appreciate all the partnerships from my city departments and John Foley at Sedesco. We're feeding about 3,500 families on Fridays. The Cabinet had just a brief update. They'll be more specific. Springfield Police Department, Commissioner Cheryl Clapper indicates to me she is down 37 with COVID-19, 7 of which are recruits in the academy. Very happy that the vaccine shots have started. Knock on wood, it was a quiet weekend, and we hope to continue with that. Springfield Fire Department, Commissioner Calvi indicates to me he's down 3, but he has 19 quarantined. Total 22. Vaccine shots again have started. There was a fire on Chapin Terrace, but overall it was a quiet weekend. I want to thank Commissioner Calvi. He's done yeoman work. We're going to have a United Dispatch unit very shortly in February. That's a major, major accomplishment for a city our size. So, major dispatch center, United Dispatch Center, and that'll be to be announced completed February. Superintendent Warwick continues. We continue to feed our students and families. We doled out 98,270 meals this weekend, which includes breakfast, lunch, dinner, and snacks. Overall, we have continued to feed our students and families to the tune of 5,400,266 meals. As I stated before, the retrofitting of the schools continues. The I-Waves at Putnam Vocational were very, very impressive. Student athletes have been tested, 208. And again, I thank Superintendent Warwick and Commissioner Helen Carlton Harris. DPW front, Director Signoli indicates to me he's down 4 on COVID-19. Christmas tree pickups continue on your recycling day. You'll have some updates on the shared streets grants that we received, applied for, the bump out that will occur on Worthington Street for Theodore's Restaurant, the Main Street uplighting that's going to occur, the beautiful lighting, old school lighting you see at Worthington Street on the Theodore's area, the Fort area, Ladine's, we're going to be doing that. Main to Howard Street, also we're going to continue to do that. And the Tiffany Street culvert he'll speak of, we'd also received funds to continue to secure that area. On the financial front, my Chief Administration Financial Officer, TJ Plant, indicates to me revenue loss since this has started is $7.7 million. There's been a little uptick in loss of revenue for FY21, $2.87 million. Total in deficit spending and grants is $18.7 million. Of that, 11.2 we've been able to work through grants. We're still dealing with a $7.5 million deficit, which again, we're going to continue to be creative with grants and going after FEMA money for the residents and business community of the city of Springfield. Facilities and Parks, Pat Sullivan again, he is down 3 with COVID-19. His team has done a fantastic job retrofitting our schools and all our buildings with the eye waves and the carrier air filtration. Again, he's working with Commissioner Helen Carlton Harris, potentially 10 sites, logistically 10 sites, so we'll be ready to rock and roll for vaccine distribution to our public as soon as possible. He'll also indicate, I know he's got to cover an 11:30 for me, but many people are asking for events, meetings down the road. If you could please be patient, we will assess everything as it comes in with Commissioner Helen Carlton Harris, but even though it's months down the road, we have to see how the virus goes and how the vaccine distribution continues on. The Sear Arena will continue to assess, but it'll continue to be closed following the governor's guidance. And Director, Chief Development Officer Tim Sheehan will speak to you about the federal employment aspects and the Congressman Neal meeting. He is down, COVID-19, he is down 4 employees. Law, HR, Labor, Solicitor Ed Pakula and Attorney Bill Mahoney. Again, Ed, the DOJ conference calls continue. Attorney Mahoney indicates to me the federal unemployment level has stayed status quo at 6.7. We don't have the state or city of Springfield in yet. What was a little bit of alarming is that there was an unexpected loss of jobs. So that's the brief update, and with that, we will again follow with Dr. Kerouac and Dr. Ruse to make their presentations, and subsequently after they speak so they can get back to their medical establishments, they will take questions from the press. So now I will welcome the President and Chief Executive of Bay State Health Systems, Dr. Mark Kerouac.
Good morning, everybody. Thank you, Mr. Mayor. Appreciate, as always, your holding this event and the cooperation of your team. Well, unfortunately, COVID-19 continues to spread rapidly in our communities and across the world. Across the globe, there have been over 90 million cases. We're closing in on 2 million deaths. The United States has seen over 22 million cases, 370,000 deaths. Daily new cases have been at about 250,000 on average, and the surges from the holidays, which everyone expects, have still yet to come. There are currently 129,000 individuals in United States hospitals. Massachusetts now has over 413,000 cases and over 12,800 deaths. On average, Massachusetts is seeing 4,000 to 5,000 cases a day, with over 60 deaths on average. Hospitalizations across the state are running around 2,200, with over 400 in the ICUs. Hospitals in the east are nearing capacity in regular med-surg as well as ICU beds, that number being over 85% or so. Bay State Health has actually been holding steady in terms of our inpatient numbers to even slightly declining. We're currently at 137 as a system. 114 of those are at Bay State Medical Center in Springfield, 23 in our community hospitals. Only 11 are in critical care situations. We are making better use of home care with the use of home oxygen for people who have milder cases or who are in the late stages of recovery, and that enables us to keep inpatient capacity a little bit higher, so that might be affecting the slight decline that we're seeing. We still, though, are expecting, according to the computer models that we're following, the post-holiday surge to occur in the next couple of weeks. Our test positivity rate is about 8%, which is about the same as the state, and so new cases continue to arise, although the overall level of cases in our hospitals has come down slightly. Vaccination centers, at least until today, up at our center have been proceeding briskly. A total of 7,800 employees of Bay State Health have received their first dose, and 1,900 have received their second dose. We're able to do about 1,000 individuals a day at the center. Sadly, I'm sorry to report we're going to have to stop today because we have run out of supply. And we don't know when our next shipment is going to be coming. About 1,900 employees have declined. That's about 20% or so. Roughly 60% of those are soft. When I've read information from the state, questionnaires and interviews of people who are declining, particularly among communities of color, many of those are individuals who simply are trying to find out more about potential long-term side effects and to hear from trusted voices. And so I'm very optimistic that initiatives like the Vax Force that Commissioner Helen Calton-Harris is putting together will have the beneficial effect of persuading more people to take the vaccine and reduce their risk of a serious natural infection. Among the people who we vaccinated, sore arms are pretty common. There are occasional flu-like symptoms, particularly after the second shot. However, fewer than 10 people out of the nearly 10,000 that we have vaccinated have had serious allergic reactions that have required medical treatment. And so we figure that that's an acceptable safety performance. We have been designated a depot for vaccine for private practice providers. These would be private doctors and their staffs in the community. And we will either begin to distribute them to the offices or to vaccinate those individuals if that's what they'd like when we get our next shipment. The state is continuing to follow its plan, which is available on its website, Mcas COVID-19 Vaccine Plan. Phase 1, which we're pretty much well into, were healthcare workers and long-term care residents and staffs of those facilities. Happily, this week we'll be starting first responders. We'll also soon be starting folks in congregate care facilities such as prisons and shelters, and then finish off phase 1 with home health workers. This is hopefully all going to happen in January. In phase 2, in February, we're going to start getting into patients at high risk. These would be individuals with 2 or more comorbidities, things that make COVID more serious, like high blood pressure, diabetes, obesity, etc., or individuals over 75. Moving on then to essential workers in non-healthcare settings, such as education, utilities, grocery workers, public works, etc. And then finally, the elderly over 65 or with one of those comorbidities. Finally, then by April, we're hoping to start, the state is hoping to start with the general public. There has been some variability between the states in terms of how efficiently they have given out vaccine in terms of doses administered per capita. And there's been some variability within the Commonwealth as well. Part of the problem has been that the supply from the federal government has been unpredictable. The state doesn't know from one week to the next how much it's going to get, and they tend to find out at the last minute, so it's hard for them to coordinate with the folks that they themselves are supplying. I certainly applaud the plans of the Biden administration to get at all available vaccine out to the states as quickly as you can. There have been a variety of rules and approaches that the states have used as well, which have resulted in differences in terms of how the vaccine has been given. The CDC issued some guidance a few weeks ago, but it was simply suggestions, and the states are allowed to interpret those as they wish. And so you see a wide variation all the way from states that have what I would call loose and fast rules. Florida and Texas would be good examples, where they're just trying to get vaccine to as many people as they can. In Texas, for example, the administration right now is for somebody who is either a healthcare worker or over 65 or somebody with one of those comorbid conditions. So much more open kinds of administration. What happens then, of course, is that there is a rush on vaccine. There's no problem finding willing people to get it. And oftentimes people in underserved groups will tend to be vaccinated at lower rates than others. So in conversations with a friend from Houston, I'm learning that many folks who are patients in the Houston area are getting vaccine. They're well past their healthcare worker group, but many places in rural Texas have yet to see a single dose. So things are a little bit messier. It doesn't have the orderliness of if indeed you use loose rules, but you do get the vaccine out the door. On the other extreme is a place like New York, where they have very strict and very rigid rules, and they're actually threatening providers with the loss of their license if they allow people to jump the line. They've been seeing, I guess not surprisingly, that some wealthy New Yorkers have been trying to jump the line and get in front of other people. And what that does is cause things to slow down, and you end up having a lot of vaccines sitting in freezers, and that does nobody any good. The hope is that we in Massachusetts can find a happy medium between those. Right now we are a little behind Connecticut and Rhode Island in terms of the rate of vaccination per 100,000 people. We are vaccinating about 6,000 to 7,000 individuals a day, and that's nowhere near fast enough. If you do them, we've given out 150,000 doses of 328,000 doses that have been received. So there's still a fair amount of vaccine that's yet to be distributed. We are going to need to get up to 40,000 to 50,000 vaccines given a day if we're going to make the timeline of getting everybody vaccinated by the summer. So we can expect a lot more places to come online, large centers, multiple sites, and that's assuming the product is available. We definitely need to pick up the pace, and I know the state has a number of plans to make that happen. If you want to learn more about the vaccine or how it's rolling out, you can go to the Bay State Health website, baystatehealth.org, or to mass.gov and hit on the vaccine link, and they've got good stuff there as well. In terms of the actual infection and the virus itself, what happens in the next few weeks depends a lot on what folks did over the holidays and how well they're lying low now if they chose to travel or be with households other than their own. Remember to get yourself tested if indeed you have done that and start having symptoms. And for everybody, until we get to that point where we're vaccinating at a rapid clip, continue to follow that public health guidance of masking, social distancing, and hand washing. And that even includes people who have been vaccinated, because 95% protection is not 100% protection. You do not want to be the vector for others, even if you've gotten vaccine. So, Mr. Mayor, thanks for the opportunity as always, and I guess I will pass it over to Dr. Rob Roos, the Chief Medical Officer at Mercy Medical Center.
Thank you, Dr. Kerouac. Dr. Roos?
Thank you, Mayor, and thank you, Dr. Kerouac. It's great to be with you again this morning, and thank you to the media for continuing to cover this important issue. This morning, I'm going to just jump right to the point as well. At this point right now, despite all the things that we've learned and all the things that we have done, the state of the pandemic at this moment is as bad as it's ever been when you look at the metrics. COVID is more prevalent across the United States, meaning that there are more cases per population now than at any point to date. It is more infectious, as there's now a variant of the virus that is spreading more easily and is present in dozens of countries and here in the United States, including in the Northeast. And it has been more deadly in that it's caused more hospitalizations and deaths in the past week than in any week prior. So we are still very much in a critical period. And we have a light at the end of the tunnel, but we are in what seems to be a race against time to vaccinate as many people as possible to be able to protect each other's health as well as our country's health system over the next several months. There have been more than 90 million infections across the globe, with nearly 2 million deaths, and over 500,000 new cases are reported each day, of which we know more than half of those are here in the United States. There are also exponential rises in the numbers of new cases in certain countries, like the United Kingdom and South Africa. Here in the U.S., there's been nearly 23 million confirmed cases, over 375,000 deaths, and in the past week, we've set 2 more records for the number of new cases in a day at over 280,000 and the number of deaths in a day at 4,100. The surge across the country is impacting every region: the South, the West, the Midwest, the Northeast, the Southeast. And states like Florida, New Jersey, Michigan, Texas, Arizona all had more than 500 deaths just in the last week alone. We do not want to get to that point again here in Massachusetts. And in Western Massachusetts, we have largely fared better than many other areas. But we are not immune to the same realities that are being experienced elsewhere if the infections continue to climb. As you may know, this past week, the Department of Public Health debuted a new interactive dashboard online instead of the PDF version that was being uploaded every afternoon. It allows you now to look at the cases, hospitalizations, deaths in a variety of different formats and also by age, race, and city and town. As of last night, the number of new cases reported per day has risen to almost 5,000 per day. The test positivity remains over 7%, and hospitalizations remain high at nearly 2,300, with over 450 in the ICU. It also judged hospital capacity to be at over 85% across the state. While that may not be our experience on a daily basis here in Western Massachusetts, Governor Baker did escalate all hospitals to a Tier 4 last week, meaning that every hospital in the Commonwealth is engaged fully in their plans to deploy more resources to increase bed capacity, to expand testing, and every hospital is communicating together with hospitals in their region every single day to talk about whether or not there's needs to transfer patients between or amongst facilities or to alternate sites like field hospitals in Worcester or Lowell. And although we have not needed to transfer patients outside of our system within Trinity Health of New England, at Mercy, we continue to evaluate this every day, and we are also seeing increases still in patients needing hospitalization from COVID. As of this morning at Mercy, we have 33 hospitalized patients. We've had as many as 35 last week, and although there are only 2 patients in our intensive care unit, when we look at our curve of hospitalized cases, we're now averaging in a given week just as many patients as we were during the first surge in April and May. So our curve now looks exactly like a U. We're right back to where we were. And that's in addition to all the other patients, about 3/4 of our hospital, that continue to receive care for other conditions like heart disease and stroke, cancer, infections, injuries, giving birth, for example. So just like it was then, our message to you now in the community remains the same. We are here for you. We continue to provide all types of care, have the latest therapies for COVID, and care for all types of conditions. We have expanded our testing, but we've seen our test positivity rate actually go up to now 13% in the past week. We do still have adequate supplies like ventilators. We have the adequate PPE that we need and good resources to support that. And we do have capacity within our hospitals. So our focus remains on prioritizing and delivering safe care always to you. Something that we think has been validated not only by our protocols, but also by our A grade in safety by the Leapfrog Group this year. But we need you to preserve our staff and to protect yourself and others by doing your part to stay safe, remain vigilant, and sign up to receive a vaccine as soon as you are eligible. This is so important. With our current situation looming large, we could be in a situation where it becomes much worse before it gets a whole lot better. And we only have a limited amount of time until we can vaccinate enough people to create herd immunity. When we look at the numbers Thus far in Massachusetts, according to the vaccine dashboard, as of last Thursday, so it's a few days old, there had been 141,000 doses administered of the 328,000 that had shipped out to the state thus far. That is largely due to holding back dosages within the states to ensure that we have enough second doses for everyone starting their vaccine. But we really do, as was mentioned, need to escalate this as much as possible. At Mercy, we've administered over 2,000 vaccines. We've had over 250 now receive their second dose, with about 1,000 more scheduled for this week. And of note, we have not had one single wasted dose. Every single dose in every vial is getting utilized. And all of the vaccine that's been allocated to us for first doses has either been given or is scheduled to be given in the next day or two. So we too are running out of our supply to continue to expand our effort. We've been vaccinating healthcare workers who've been involved in the care of patients that include COVID, and we are ready also to begin vaccinating first responders and other healthcare workers in the community once we're allocated more supply. In regards to the best way to accelerate that, there's been a lot of discussion regarding whether or not to release a lot more vaccine or hold some back to ensure that there are second doses available to be delivered on schedule. And I think that this is a decision that really hinges on what's the problem that we're trying to solve. We absolutely all agree that we need more vaccine manufactured, more delivered, and more injected into people's arms. If and where the issue is availability, we absolutely need to get more vaccine distributed out to the states so that that can be distributed out to vaccine centers and hospitals to get that vaccine into people's arms who qualify. Where the issue is in execution, where there's vaccine sitting and it's not getting into people's arms, well, then the focus really needs to be on the resources, the people power, the support, and the logistics to close that gap. And I believe that that may be different in different areas of the country. Here, we need more vaccine. But I don't believe that we should begin deviating from the protocols outlined by the FDA based on the clinical trials. Right now, we have people who we've given a first dose to based on evidence from trials that identified an effectiveness based on a 2-dose series that has a certain interval. It's not yet known what reduction in effectiveness would occur if we space that out significantly, and I'm talking months or longer. We also need to make sure that we should not make that decision unless the science is able to justify that that effectiveness trade-off would be worth it. Of note, in the United Kingdom, where they've made a decision to push more vaccine out and then schedule second doses out months as opposed to weeks, they've made that decision based on some science that is available on the timing of doses for the AstraZeneca Oxford University vaccine, where it does support that there is significant lasting immunity even when the doses are spaced out by months. But of note, that data does not yet exist for the Pfizer or the Moderna vaccines. We do need to vaccinate more, and we need to vaccinate quickly. We know that we have the variant that is causing spread more rapidly in the United Kingdom, right here in the United States. Some of the patients that have been treated through our sister ministry in Hartford at St. Francis Medical Center have had the coronavirus sample sent to the state lab, and it confirms that the variant is present right here in our region. I believe it's right here in Western Massachusetts and could be leading to more community spread than we otherwise would have expected with the same number of cases. The good news is that the Pfizer vaccine, based on some initial laboratory studies, does appear to be effective against this variant. Although it hasn't been studied in the same way, since the Moderna vaccine has essentially the same technology, it is likely that it also will have effectiveness against this variant. And so that's good news. And I would argue we need just to continue with our push for vaccination. The vaccine is safe. This vaccine is effective. And so I urge us to stay the course through communication, through collaboration, through resource deployment. We should not be tempted to stray from the science as that will be our ticket through this. We are facing a potentially dark moment, but these vaccines, for all of us, for me, for you, for your loved ones, and our entire community, remain the light that can lead us through it. So please stay safe, remain vigilant with masking, avoiding gatherings, maintaining physical distance, and sign up for the vaccine as soon as you are eligible. Thank you.
Thanks, Dr. Russo. Dr. Russo, Dr. Kerouac will now take any questions or comments. I know that the rest of us here for 22, Mike, Eric, 40, Paul, Tuthill, Matt. So if you have any questions or comments, Dr. Kerouac, Dr. Russo. Paul, go ahead. Paul, go ahead.
Dr. Kerouac, you said that you're just about out of your supply. You don't know when you're going to receive more. How many of your employees have been vaccinated?
We have 12,000 employees. 78,000 of them have received at least, 7,800, pardon me, have received at least one dose.
And those are the ones that were eligible in that first group. You know, I think you mentioned about 7,800, 8,000 was the number that, is that right? Or
That we're clinically facing. We pretty much have invited everyone, and because all healthcare workers are essential and can be redeployed into clinical areas, and we had some declinations, we just continue to invite our entire workforce.
when would the people who had received the vaccine initially, when would they be coming due for their second shot? That would be relatively quickly.
3 weeks for the Pfizer, 4 weeks for the Moderna.
I'm sorry.
3 weeks for Pfizer and 4 weeks for Moderna.
So
It's been 3 weeks for the Pfizer vaccine for roughly 2,000 individuals. They're pretty much done.
and if they received their second dose?
They received their second dose, and we've been dealing solely with Moderna since that initial. So we were initially given about 2,000 doses of the Pfizer, and then we're given a second 2,000, which were earmarked to be the second doses. But since then, the additional 6,000 or so employees have been all with the Moderna vaccine.
So with first responders becoming eligible for the vaccine today, and obviously there's been vaccine distributed to, as I understand, about 60 locations around the state now for first responders. I mean, is this an issue with the state not having a vaccine supply? Are they holding it back? Why can't you get the supply that you need?
I think that they are holding vaccine back for specific groups and specific plans, rather than releasing the vaccine and assuming that the second doses will come via a reliable supply chain. They're just nervous that the supply chain is not as dependable as it ought to be.
Thanks for Dr. Russo.
Our experience has been exactly the same. So the experience at Mercy Medical Center has been just what Dr. Kerouac described at Bay State Health. We too are out of the vaccine that we have been allocated. We are eager for more. And I think it's a matter of timing and process for how DPH wants to distribute it to certain centers at certain times to go through their process and their order.
So are you concerned that you're not going to get any more?
Of course.
Yeah.
Of course.
Yeah. Yeah. I hope that we will, and we expect that we will at some point, but we just don't know when, and that's been part of the challenge here.
Yeah, I mean, nationally, I think 22 million doses of vaccine have been distributed and only about 6 million have been administered. So, you know, this happens as you're beginning a brand new logistical process. It's lumpy and it's bumpy. There's an interesting article this morning in the Boston Globe about the bumpiness of the rollout of the polio vaccine. So I expect that things are going to pick up, and they certainly are going to need to pick up big time. I mean, 5 to 7 times as fast as we are right now if we're going to make our deadlines. So it's really going to need to change in a big way. And part of the solution, I think, would be for the federal government to release everything they've got as well. Additional vaccines coming online by different manufacturers will help in addition.
Dr. Kerouac, you said you're out of vaccine. Are you concerned that you're not going to have your second dose for people that are the other 5,000 or so that already
No, I think we'll end up getting it. The problem is that the state doesn't know what they're going to get until a couple of days before it arrives too. So the information and transparency and the regularity is not there. The predictability is not there. And, you know, the problem is when you try to plan this too carefully, you end up over-allocating in some areas and under-allocating in others. I mean, this happened in Massachusetts in the first wave of the Pfizer, that there were some small independent hospitals that got more than they needed, and big places like Bay State got less than they needed, and the small hospitals were wondering what to do with their excess.
And so just to understand what you said a moment ago correctly, do you support President-elect Biden's suggestion to release everything that they have? And
To the states,
not worry about
right.
whether or not we're going to have a second dose?
Yes, I think that there need to be rules by which the vaccine is distributed. Don't get me wrong. It shouldn't just be a free-for-all.
Right.
But it ought to be released to the states, and the states themselves, I think, should release it to regional distribution centers and then set up rules by which they ought to be distributed and oversee those rules. Because that's the only way we're ever going to get to the sort of scale we need.
And just out of curiosity, have you heard anything new about the potential third vaccine, maybe getting the Johnson & Johnson's in the pipeline? There's the U.S. trial where they went for AstraZeneca. Do you have any sense, other than like the Operation Warp Speed director said a couple of weeks ago, as to what we could expect from these vaccines?
He would be a more reliable source than I would on that. But I'm expecting, given the size of the trials and where they are, that it would probably be, it might be February or March by the time we got additional vaccine up and running. I do know that the vaccines, for instance, AstraZeneca, has been released in England and India, I believe in Canada. It appears to be quite effective and doesn't require the freezing issues. Johnson & Johnson is a one-shot vaccine and a more traditional kind of vaccine as well.
Dr. Lewis, anything?
The only addition that I would have is just to clarify. So for Mercy Medical Center, we are going through our second doses of our Pfizer last week, this week, and then into next week. And we have all the doses that we need to complete those vaccination series. So we have not distributed or administered that vaccine. We have kept that vaccine to ensure that we have the second dose to be on time with that schedule. We don't have any more to initiate any more series for either Moderna or Pfizer at this point. And we are still waiting for our distribution from the state for the second doses for the Moderna that we started. But since that started later, we still have a few weeks to be able to get that.
Actually, just one quick follow-up for both of you. Is all of your patients, all your staff that are potentially COVID patient-facing, have they all been vaccinated or was given the opportunity to do so?
They've all been given the opportunity. We have a declination rate of about 20%.
Yes. Yes, they've all been invited.
Thank you.
Any other questions or comments? I want to thank Dr. Kerouac and Dr. Ruse. Next week, just for your knowledge, because of the MLK holiday, which is Monday, we have events going on. We will meet Tuesday. Tuesday will be the press update from the city and our medical experts here. So next Tuesday, which would be the 19th, I believe. 19th. Instead of Monday, because of an honoring of the Martin Luther King holiday and events going on. Dr. Kerouac, Dr. Ruse, thank you very, very much. And as they continue with the vaccine, I think you'll see with the incoming President-elect Biden administration coming in, they'll be laser focused on this. The past administration seemed to be a little bit of a sideshow on it, so you see the laser focus on it. And I also think in our logistics, and Commissioner Helen Carlton-Harris will go into it, Pat Sullivan, when the public sites start, you have to make sure logistically the sites we have backup generation, because you just don't want those vaccines to go bad whatsoever. With that, I will introduce our own, my Dr. Anthony Fauci, the Commissioner of Health and Human Services, Helen Carlton-Harris. I deeply appreciate her efforts and her team's efforts as we continue to move to defeat this COVID-19. The Commissioner of Health and Human Services for the City of Springfield, Helen Carlton Harris.
Thank you, Mayor. As always, thank you very much for your leadership. Good morning. I am going to begin with the data. The data that I'm going to begin with to my left is the line graph that looks at the number of cases on a monthly basis. And as you can see from the line graph, our highest, December, the 4,496 cases. Already in January, we have 1,351 cases. The next area is the confirmed cases from January the 3rd to January the 9th, 2021. On Sunday, 138 cases, Monday, 174, Tuesday, 110, Wednesday, 182, Thursday, 220, Friday, 138, and Saturday, 215. Remember, in order to give you complete data, I am just giving you till Saturday. We do not have the final numbers for Sunday yet. Those will come in today and be reported next week. I'm going to go to the confirmed COVID-19 cases over the past 6 weeks. And as you can see, the week of November the 29th, there was 1,168 cases. That following week, 1,033, 957. The following week, 866. There was no testing. I believe that was during the time that weekend that we did not do testing on Wednesday, Thursday, and Friday. 910 the week of December 22nd, and now, this week, 1,177. And as you can notice, this is the highest week that we've had since the beginning of the pandemic. The 1,168 was the highest. We have topped that this week. Next, the COVID-19 cases by age group, January 3rd to January 9th. 0 to 10, 120. 11 to 20, 156, 21 to 30, 221, 31 to 40, 195, 41 to 50, 160, same number, 160 for 51 to 60, 61 to 70, 86, 71 to 80, 51, 81 to 90, 20, and 91 to 100, 8 cases. We continue to see the majority of the cases, and I am looking at the percentage by age group now. The 30 and under, 42% of our cases. The 31 to 50, 30% of our cases. 72% of our cases are under the age of 50. 51 and older represents 28% of our cases. Looking at our zip codes, in 01101, there were 4 cases. And 01103, 14 cases. 14 cases, which is 1% of the cases. 01104, 174 cases, which is 15% of our cases. 01105, 82, which is 7% of our cases. 01107, 105, which is 9% of our cases. And 08, there was 258 cases, which is 22% of our cases. 09, 215 cases, 18% of our cases. 18, 108 cases, 9% of our cases. 19, 85, 7% of our cases. 28, 18, 2% of our cases. 29, 64, 6% of our cases. And 01151, 4% of our cases with 50 cases. By race, we're looking at right now, the unknown is 24%, Black African American, 16%, Latinx, 22%, white, 32%. I think it's important for us to look at that Asian positivity percentage. I have not seen that percentage in our Asian population, 6%. That is higher than we have had. And so it's going to be important for us to continue to reach out to our Asian population in the city of Springfield, which pretty much will consist, I believe, of our Vietnamese population, and we will make sure that we are paying attention. But it's important to recognize that that population has seen an increase in the case positivity rate. So the total confirmed cases in the Commonwealth, you've heard, 413,323, which is an increase last week alone of 45,342 cases. The total deaths among confirmed cases, 12,875. 612 people died last week in the Commonwealth of Massachusetts. Hampden County, 30,270 cases. That is an increase of 3,384. And the city of Springfield, as you heard, has almost a third of those cases that were reported last week. The total deaths in Hampden County have been reported, and the city of Springfield, as you have heard, has 168 deaths. We increased by 10. I'm going to take a moment just to talk about the individuals who have died. We lost a 77-year-old, and this is the 10 that have died that we reported today. We lost a 77-year-old Hispanic female who resided in 01107. We lost a 73-year-old Asian male who resided in 01108. We lost a 53-year-old Hispanic male who resided in 01105, a 69-year-old Hispanic male who resided in 01109, a 68-year-old Hispanic female who resided in 01109, a 77-year-old Black male who resided in 01109, a 73-year-old Black female who resided in 01104, a 78-year-old white male who resided in 01129, a 87-year-old Hispanic female who resided in 01107, a 79-year-old white male who resided in 01118. In giving you that information, it's my attempt to make those individuals real for you. These were real individuals who died from what I believe is a preventable disease. And the prevention has everything to do with the preventable virus, I should say. The prevention has everything to do with what we have been telling you that's important to do. We recognize there's a surge across this nation and certainly in the city of Springfield. We recognize that community spread is with us. It is all over the place. It is pervasive. However, we do have choices. There are things that we can do so that we don't continue to report the number of deaths. As the mayor said, this is only to January 3rd. I am confident we will continue to lose individuals in our community, and I'm confident also that this does not have to happen. We are doing the PrEP mod registration right now for first responders. Our vaccine rollout will start tomorrow. Again, this is for first responders only at this point. They have pre-registered through PrEP mod, and we will begin that vaccination process tomorrow. The site is at Bowling School that has been published. We have developed a clinic operational plan, so we believe that we are prepared to move forward. we will continue to work with facilities to think about when we vaccinate the general public and how we roll that out, and really what our role is, because that has not been established for local boards of health, but we will continue to move forward. AMR testing, amazing job. The superintendent will report on the testing for the student athletes, but to date, AMR has tested 108,690 individuals. That is unprecedented. 45,923 of those are Springfield residents. My nurses are, excuse me, I have a tickle. No, I'm good. I'll end with saying our staff has transitioned from contact tracing. We're sending those over to the CTC, and they are focusing on vaccine at this point. So please, again, make sure that you are paying attention and doing what's necessary when you're called to have information around contact tracing. And so the Contact Tracing Collaborative will be doing much of our work until we get through this week. Then we'll continue to pick up additional cases. I am very appreciative of the partnership. I continue to talk about the City of Springfield and how we work together. Springfield Department of Health and Human Services staff, along with AMR, along with Springfield Public School nurses, will be working the vaccine clinic this week. That is amazing because it shows once again how we work together, how we help each other, and so I am really confident that we will run a very comprehensive, concrete, and smooth operation tomorrow and for the rest of the week. So thank you. Remember, again, watch your distance, wash your hands, wear your mask, and please stay home if you're not feeling well. Thank you.
Oh, here, there's a cough drop here, too.
Thank you.
Okay, and there's some water for you. Thank you, Helen. Thank you, Commissioner Colton Harris. We will now go into the public safety component of this COVID-19 update. And we will start off with the Fire Commissioner of the Springfield Fire Department, Bernard B.J. Calvi.
Thank you, Mayor. Good morning, everyone. This week at the Springfield Fire Department, we have 3 firefighters positive with COVID who are out of work right now in quarantine. We have 19 additional firefighters who have had a close exposure, been exposed, who are out and are going to be tested. So we're in decent shape this week. Our positive tests are down. We still have people waiting testing, but we're in good shape. We're still out there for the community. I'd like to thank all the firefighters, officers, and chiefs for the hard work they're putting in to make sure we're keeping the transmission of COVID to a minimum. We've had a good weekend this weekend. We had a small fire in Chapin Terrace on Friday afternoon that was quickly extinguished. We had no injuries, and we're continuing to move forward. That's all I have for this week. Thank you very much.
Thank you, Commissioner Calvi. Thank you very much, Commissioner Calvi. We'll now bring up the Commissioner of the Springfield Police Department, Cheryl Clapper.
Thank you, Mayor. Good morning. As noted, the Springfield Police Department, we're down 37 employees. That's 28 employees testing positive, and that's 9 who are quarantined or waiting test results. Of concern to me is 3 recruits are in that positivity number, and 4 recruits are in the number that includes quarantine or awaiting test results. This was because of the class being split. Part of the mandate in the recruit class is EVOC training, emergency vehicle operation classes. They go to Fort Devens. They travel from East Street and they go to Fort Devens and they spend all day there. Apparently there was a positivity outbreak. They have all been isolated. 3, like I said, tested positive, so the cruisers are cleaned again. I want to thank Patrick Sullivan. The station is being cleaned constantly. We have all the air clarifiers in operation. I hope that it doesn't mean any type of a delay in getting the class out. Again, I look for this class to graduate in April. We need them out as soon as possible. It is a mandated class, so we're working with the state police. They're the instructors on that class. They have been notified, and hopefully we won't miss a beat with the academy getting out. That being said, I'd also like to thank Commissioner Helen Calton for her assist. We do have officers who wanted the vaccine. Get online and are scheduled this week from Tuesday to Friday to be given the vaccination at Boland School. Between the positivity rate at the station and those who are accepting the vaccine, I'm hoping to see better numbers soon at the police department so that we can go back to the two-man cars and a little relaxation with all the cleaning materials. And hopefully that class, as I said, graduates on time. Thank you, Mayor.
Thank you, Commissioner. Thank you, Commissioner Clapprood. We'll now get the school update from the Superintendent of Springfield Public Schools, Daniel Warwick.
Thank you, Mayor. Morning, everyone. So our meals program, we continue to help the community meet the food insecurity need. Year to date, since we closed down in March, we've provided 5,400,266 meals, 98,220 this weekend only. So again, we have 18 sites going on that. It's been an enormous success, and I'm very proud of my staff. Another positive number for us is our attendance. Our attendance rate remotely has actually increased in the last few weeks. It is now at 92.2%. So for it to be only about 1.4% off the normal attendance rate, given we've been remote all year, I think is rather incredible, and a real tribute to the tremendous work of our staff reaching out to parents and students and making sure folks get involved and stay involved, and that's been a big success. As we've said before, but just reminding everyone, our school committee did have a reopening vote talking about our large group of students coming back at the beginning of the fourth quarter, which is early April. But they did allow us to submit a plan to provide an opportunity for some specialized group, high needs special education, some of our ELL students that had learning gaps where they didn't attend school for years, and some of our vocational students in grades 10 to 12 that need certain hours required and need the hands-on piece to come in before that point. And we're looking in working with school committee to develop a plan around that and put it forward to school committee. In conjunction with that, we've been working very closely with Pat Sullivan, the mayor, and Bob Kirshner. We're doing a tremendous amount on the ventilation systems in the schools, and I know everyone's heard a lot about ventilation systems since this started, but we're really doing some significant work, over $1 million worth of work, thanks to the mayor's support, not out of the school budget. So, our schools, from a ventilation standpoint, will be ready in early March for a safe return for our students in light of this COVID situation. This is more work than any school system in the Commonwealth has done, and again, is due to the mayor's great support. So when our school committee is ready to return, the ventilation systems will be improved in all of our buildings significantly. Flu shots, just reminding parents to make sure we take care of the flu shots. We did get a little extension on that through January and February, but we still want, before students return, for them to have taken care of those flu shots. Mcas testing, there's been some clarifications. We don't have to do the 12th grade retest for the class of 21. They're going to go with a CD requirement. So that was good news from DESE. And all the other testing has been put back into the spring, but there's still a lot of discussion about the importance of taking those tests this spring. DESE is talking about a reduced testing protocol, and there's still going to be more discussion and input on that. As Helen said, and with her great support, we're looking at trying to provide some of our student athletes an opportunity to participate in our winter program like we were able to do this fall. But with that, we decided to do 3 tests. Again, our health commissioner gave us advice that doing 3 tests with all the students would be a really good safety protocol, so we're going to do those tests. We've completed 208 tests so far for our winter athletes coming in, and only 5 were positive, so that's absolutely tremendous and gives us a good signal we'd be in good shape to start our winter program. And again, that's basketball and swimming. Wrestling has been put off till the spring. And again, another thing that's gotten some attention statewide is the new student learning time requirements DESE passed for both remote and hybrid learning. And our remote plan exceeds the requirements, so we didn't have to modify our plan. So we're where we need to be relative to the amount of instructional time for our students. Thank you.
Thank you, Mayor. Thank you, Superintendent Warwick. We'll now go to the report of the Department of Public Works, and that is Director Chris Signoli. Director Signoli.
Mayor, thank you. The DPW has 4 employees out due to COVID. We are in the second week of 4 weeks picking up Christmas trees around the city. Through the end of this year, we have seen, excuse me, a 20 to 25% increase in the amount of collection of trash, recycling in bulk. So we expect that to continue through next year. The city has been awarded a Shared Street program through the state. We will be in front of the City Council tonight. That will be expansion of sidewalk seating in the lower Worthington Street area and the area of Theodore's. We were notified of an award for string bank replacement and upgrade work for the Tiffany Street culvert. And the city will also be making applications to the Mass Gaming Commission for transportation improvements for various locations in the downtown area. We haven't decided what those are with the city. A few weeks back, 2.5 weeks ago, we received a major donation from MassCon with regard to PPE, and that is being distributed throughout the city with the city departments, and it has been a major help for each of the groups in the city. With that, I am all set, Mayor. Thank you very much.
Thank you, Director Signoli. Pat Sullivan is covering 11:30 for me. We received his update, so we'll go again. Springfield's in the business of doing business, and I'll now bring up the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mayor. I just wanted to take a moment to unpackage some of the information that was released in the federal jobs report that was released on Friday, because I don't think the percentage number accurately reflects the whole story. As of December, there were 10.7 million people in the United States that were unemployed. 4 million of them had been unemployed for longer than 26 weeks. This particular report was the first time that we've seen job losses since April. There was approximately 140,000 jobs that were lost in that month. And when you look at this in terms of the impact that the unemployment has had, particularly on women, Latinos, teenagers, and the least educated people in our workforce, and compare that with the folks that haven't really had, significant economic impact, the disparities are quite overwhelming. The largest impact has been in the leisure and hospitality market, such as casinos, restaurants, that we all know that we've been trying to work to sustain them through this process. And that particular sector has lost 3.9 million jobs, and it accounts for 40% of the employment whole. Latino and Black workers, their percentage of unemployment is 9.3 and 9.9% respectively, compared to 6.5% for whites and 5.9% for Asians. College-educated unemployment is at 3.8%. Comparatively, with high school or below educational levels, it's 9.8%. It's just to say that as we continue to look at, how to rebuild our economy and provide the necessary resources, we need to be looking at it in a much more equalized manner and bring some level of equity to the equation. Thank you.
Thank you, Director Sheen. You've already received a financial report from CAFO TJ Plan and the legal and HR labor from Solicitor Pakula and Attorney Bill Mahoney gave earlier. So with that, we'll open it up to any questions or comments you might have of my cabinet heads or myself. Paul?
I've got a couple questions for Commissioner Clapper.
Sure. Clapper.
Hey, Paul.
Commissioner, what's been the response of the department about the availability of the COVID-19 vaccination for police officers?
I think it's been good and positive. It's hard for me to give you a number of percentage of officers that are going to partake, and it's only because I've had so many positives. And those who have tested positive are getting advice from their physicians about how long from the positive do they get the vaccine. Some are saying 60, some are saying 90, some are saying get a blood test. So it's hard for me to determine, but I do know when the appointments first came out, they filled up quickly, and people know that it's serious and that we want to get back to work the way we know it. So between those who've already tested positive and people taking the vaccine, I'm hoping that we're covering 75 to 80% of the department.
And you've had over 130 positives so far, is that right?
When we start to add up all our positive tests, yeah, I think we're around 130. And you're talking 483 sworn, and then our civilian component. So we've had our share. So I've encouraged it. Get the vaccine if you haven't had a positive, and the sooner people do, the sooner we can get back to where we operated before.
And you've had it, right? You took the vaccine?
I did. I was administered the vaccine Friday morning, and I'm telling everybody that wants to know that I had exactly 0 side effects and feel wonderful, so I'm encouraging the vaccine.
If I could, the same question for Commissioner
Sure.
Calvi on the response to the fire
Mr.
department.
Calvi?
Paul, how are you? We've had pretty good response for people wanting to take the vaccine. People are signing up. So hopefully we'll reach 70% of the department who wants to take it. We haven't been quite badly as hit as the police department, but we've still had quite a few members test positive, so it's the same thing with their doctors advising them they need to wait before they take the vaccine and be tested.
Did you take it?
I had it Friday morning. I was actually the first one in line. Friday morning I got it, and I haven't had any symptoms, so I'm encouraging everybody to take the vaccine.
Matt, did you have a question?
Commissioner Tucker, I was curious if you had been in touch with or had any communication with the FBI or federal officials given the sweep of what's been going on following the Capitol. I don't know that anybody specifically with Springfield has been identified or thought of, but I was just curious if you've been in touch with federal partners. I know they've been talking to everybody nationwide.
Yeah, sure, Matt. We were in touch with them right after it happened as far as any information that affected Springfield. So we were put in touch with the Fusion Center. Our crime analysis paid attention to any postings. There was, yesterday started a little bit of a Trump rally, and it seemed to have fizzled out before it got going, but we are in touch with FBI and U.S. attorneys, and we will continue to be to monitor any activity in Springfield. As far as in touch with anyone who was there at the Capitol, no. The Capitol Police, no. I felt bad. It was awful. It's a terrible tragedy. And as I said on a radio show, I think it was Friday morning, what we have done here to prevent such a thing is thanks to the mayor's support and our planning with our state police partners. the protests we had, we overly prepared for. So what went on there exactly, I don't know. I don't know what they asked for in preparation or what they were given in preparation, but I do know that we have taken everything serious here, and we fully prepare here. We over-prepare here, and that's probably a big difference.
You mentioned that there was some kind of thing that some kind of Trump-related that happened. Was that around here specifically?
That was starting in Ludlow, and there was some activity on Facebook that it may come to Springfield, and it never came to fruition.
And one of the things that obviously been very conscious of a lot of people is that there was a very disparate response compared to some of the protests that happened in the summer. Obviously, we can't prove a negative here if we had a massive Trump rally in Springfield, but there is the preparation would have been is the same regardless of.
Absolutely the same, and I think that's why we've kept things down. We've taken the hard stance. The line doesn't bend for anybody. If you do something that is an arrestable offense, we will make the arrest. We will enforce the laws, and that would go for anyone, any group, anytime.
And just one more question on that. And I realize it's complicated because obviously people are entitled to their own political beliefs, including members of the force. But is there any, concern, effort, cognizance about some of the growing, white nationalism or violent behavior that we have seen among some people within law enforcement? There's been reports of people from Seattle or Seattle Police Department or North Carolina Police Department who are at this rally. So I'm just kind of curious, what are you doing, kind of monitor your own house for potential problems with extremism?
Exactly. I don't want any embarrassment to the Springfield Police Department, so we have reissued our social media policy, and by just enforcing that social media policy, that they not violate that they not embarrass the department or the city, I think we're keeping a lid on it. Most of our officers understand that it's a law enforcement line they should take, and we represent and we support law enforcement, and that's it. The other beliefs can stay at home, and we encourage them to just do their job. Thank you.
Thanks, Commissioner. Matt, just common decency and respect, but we have no issue with a peaceful protest, but we will not tolerate lawlessness. We will not tolerate looting. We will not tolerate anybody burning anything down or victimizing any of the residents or business community of the city of Springfield. And as Commissioner Clapperwood indicated, we act the same way with any potential demonstration, and the information we receive, if it is to escalate on the intel from federal and state that possibly negative activities can occur. And I think we have proven that point. Any other questions or comments from the media? Okay, hearing none, again, I want to thank the media, the TV, print, and radio media, again, for being faithful and getting the information out and being here every Monday. Again, Monday is Martin Luther King Day, and in honor of Dr. Martin Luther King, there are some events or virtual events going on, so we will not host our press conference for an update on the city and medical hospital COVID-19 situation. We will do it Tuesday, the 19th, will be the update at that point in time. I want to thank my cabinet heads again and rank and file for their continued dedicated efforts. They've been tested and true. I want to thank their families too. There's a partnership. They've had to stand by, he or she. And I'd also like to thank you, each and every one of you in the viewing, listening, and reading audience, the residents, city of Springfield, business community. I know it's been very aggravating. I know it's been very cumbersome, but your partnership and collaboration and cooperation will heed a successful ending to this COVID-19. We're in the midst of a surge. We need to continue to follow all the public health, medicine, and science guidelines as we balance the vaccine coming in. So with that, I wish you good health, and go out and have a great day. God bless. Thank you.